Hello, today I'd like to describe a body joint range of motion measurement system. Ranges of motion are commonly referred to by the acronym ROM of any joint on the body and can be measured by a utensil called a goniometer. We're going to use ROM to describe the range of motion for the rest of the video. On the left you'll see a goniometer. The two arms of the goniometer can be identified as the stationary arm that's placed on the proximal part of the joint and the moving arm that's placed on the distal part of the joint. The goniometer measures range of motion in degrees. To measure the joint range of motion, identify the action of rotation of the joint. Then, place the center of the goniometer directly over this point. Hold the stationary arm of the goniometer on the desired limb, the one which will not be moving, and place the moving arm on the desired limb which will be moving. Despite being the most widely used tool in clinical practice, traditional measurement tools like the goniometer present some key challenges. The goniometer must be held with two hands, which leaves neither hand free for stabilization of the subject's body or their joint. As you can see, the center of rotation and true vertical and horizontal positions can only be visually estimated, which may lead to inconsistent measurements. We consider a digital alternative to addressing these problems using wearables and an edge computing platform called Paradrop. We designed a system called GonioSense that uses wearable sensors and the Paradrop edge computing platform to identify various body motions common in physical therapy settings and precisely quantify the range of motion measurements in an automated manner. So now we're going to do a brief overview of the GonioSense architecture. So first, we have a patient who is wearing a smartwatch. And the smartwatch is where GonioSense is running, and it's collecting the ranges of motion of the joints that are being measured. So as you can see on the left there, the data is taken from that smartwatch and sent to a mobile device, such as a phone or a tablet. The tablet then basically just forwards that on to Paradrop, which is an edge computing device. Our Paradrop is a router that provides internet to people like a standard router would, and it also has a computing platform on it. So basically, it's used to analyze some of the results that come in from the phone, and then forward those results onto the cloud platform, which you can see in the top right. Then, these results are viewable by the mobile and web app at the bottom. This app can be used by the patient and the clinician to just see the results of the GonioSense trials, and be used to track progress and set goals for the patient and stuff like that. Now we're going to watch a quick demo of GonioSense in action. On the left you can see the GonioSense Android app. Basically you can see what's being typed in and kind of how that app works. They push start and stop to start and stop collection of GonioSense data. Then in the middle we can see a video of a patient taking different range of motion measurements with the GonioSense smartwatch. You'll notice too there the Paradrop platform router is sitting there on the table, which kind of enables this whole thing. Then on the right we have the web interface, and you can see on the top there you get green little pop-ups when you collect data, and then you have the chance to delete that data if you made a mistake. So if I labeled the data wrong, or I made a wrong motion or something, I can delete that on the right side there. Now we're going to do a brief demo of the web management portal. This is where clinicians and patients can go to see the GonioSense data they've collected. So first of all, we're going to log in as a patient. Then we're going to see the grid view, which is where you can look at some of your measurement data in grid form. You can do various filters like date and motion to see different data. Next, we'll go to list view, where we can see each of the measurements we've taken. You can click on them to get more details about them and like where they're taken and stuff like that, and then leave comments as well. Next, we'll see the goals page. So here we have goals that the patient has set, and looks like they failed all of them. But you can set goals as far as how many repetitions you want to do or what ranges of motion you want to get to. So here you can add new goals and see how they're going. Here's some of the repetition goals. Next, we're going to sign in as a clinician. You can see here that you can kind of select your patients here. These would be all the patients available to one doctor. You can add patients, and then if you want to, you can click on one of the patients and see basically the patient's view. So you can see the grid or the graph here, and then you can see a list of their exercises and look at details of each one. Lastly, you can download a report for each patient in Excel format, and this is really handy because you can export it to other software and use it for printing out or doing other stuff like that. Thank you for taking the time to watch this video and learn about GonioSense. Thanks.